Thank you very much, Mr. Chairman. And Ms. Bradsher, thank you for being here. And thank you for your service. Thank you to our everything you've done for our country. Thank you to your family for allowing you to do this, and for, I know, all the sacrifices they have to make in order for you to do this, because it really is an important role. So thank you. I want to start by talking about what I know will be a very large focus for you if you're confirmed to this role, and that is the electronic health record modernization. Now, as you know, the staff in Spokane and Walla Walla, where the EHR has been deployed, has really worked hard and tirelessly to learn this new system. And as you know, it has really put a strain on our providers and on our veterans. They are the current experts on this system, but I continue to hear from people on the ground in my communities that their feedback is not being taken into account or even heard. So I wanted to ask you, in this role, you will have the responsibility to oversee EHR implementation and make sure we get this right. How will you make sure that our veterans themselves and the providers are being heard and their feedback is actually taken into account during this modernization effort?
Senator, thank you very much for that question. First and foremost, the Deputy Secretary is ultimately responsible for the electronic health care record, and if confirmed, that responsibility will fall fully on my shoulders. First and foremost, we have to ensure that our veterans get the health care record they need. When I retired, I hand-carried my medical records from the Pentagon to my VSO, and we simply have to have an electronic health care record that our veterans can rely on. So first and foremost, going out, boots on the ground is how I've always led. Go to all 5 sites, listen to our veterans, do listening sessions, along with listening to our clinicians. I agree with you. Our clinicians have not seen the results of their comments come back and executed within the electronic healthcare record. So we have the opportunity now to, with the reset of the 5 sites, make sure that we're able to incorporate those recommendations enterprise-wide, because we can't have 5 different records. We need to have enterprise-wide changes and ensure that we hold Cerner Oracle accountable so that those changes actually happen, and then be able to make those changes and also scale to a large, because right now we're at medium and small facilities. We need to be able to also scale it to a large facility.
And as you mentioned, we are in a reset. And I just want to know how you're going to use your oversight role during this reset period to make sure we can deliver the care that we have promised.
Thank you, Senator. First and foremost, what we have with the reset is being able to hold Oracle Cerner. We have a much stronger, 30 times stronger penalties, so for any challenges we have.
In the new contract.
In the new contract, I'm sorry. On May 16th, we have a new contract. Also, we have 5 one-year contracts. That allows us to hold them accountable each year and to make sure that we set those markers that we need for them and then go to the next contract. So those are the 2 great changes that we have with this new contract that will allow us to hold them accountable. And also, the changes that we will make don't just benefit VA, they'll also benefit DOD, and being able to ensure, especially with the outages, we've had definitely some issues with consistency in keeping the system up. We now have much tougher penalties for those outages.
Okay, well, as you know, I will be in very close touch with you on this. We worked through it, but I just want to make it very clear, staffing cuts are unacceptable, and I hope and expect for there to be a timely resolution to the concerns on the ground from the providers that we're hearing about that as well.
Yes, Senator, if confirmed.
And just real quickly, as you know, women make up nearly 17% of active duty military forces and 19% of National Guard and Reserves. That number is rising. Talk to us about how you're going to use your role to make sure that VA is accessible and responsible to our women veterans.
Thank you, Senator. Even this nomination hearing right now is historic, and if confirmed to serve as Deputy Secretary, I would take reaching out to all veterans first and foremost, but especially for our women veterans. I have met so many women in the last couple of years who don't recognize their own service, who minimize their time, who tell me, I only did 4 years, my husband did 20, and they'll fight for their husband's benefits, but more than they fight for their own, or they won't even acknowledge their own service. So one of the things is being creative, reaching out to platforms that VA has not touched into before, and I hope if given the opportunity, that would be the first and foremost, is doing that outreach.
Thank you very much. I really appreciate it.
Thank you, Senator.